Open a medicine cabinet after 60 and you may find more than prescriptions. A multivitamin, vitamin D, calcium, fish oil, magnesium, a sleep gummy, a joint supplement, a probiotic, something for memory, something for the immune system. Maybe a bottle you bought years ago because a doctor mentioned it, or a friend recommended it, or the label sounded convincing. And at some point, the question becomes very simple. Should I still be taking all of this? That is a serious question, because after 60, the issue is not just whether a supplement sounds healthy. The better question is, what else are you taking? What conditions do you have? And could this supplement interact with your medications or duplicate something you already get? That is where many people get caught off guard. Not because they are careless. Most people take supplements because they are trying to protect their health. They want stronger bones, better sleep, less joint pain, better energy, sharper memory, healthier blood sugar, or a stronger heart. Those are reasonable concerns. And supplements are not automatically bad. Some can be useful for some people. Some are recommended in specific situations. Some help fill real nutrition gaps. But a supplement is not harmless just because it is sold without a prescription. And it is not automatically safe just because the label says natural. This video is for education only. It cannot tell you which supplements are right for you, and it does not replace medical advice. But it can help you think more clearly before adding another pill, powder, capsule, gummy, or drop to your routine. Because after 60, the safest supplement routine is usually not the biggest one. It is the one that is clear, intentional, and known by your healthcare team. Supplements can be confusing because they live in a gray area in people's minds. They are not exactly food. They are not exactly prescription medicine. Yet they are often sold in bottles that look medical, with serious labels, health words, and confident promises. And many people assume that if something is on the shelf at a pharmacy or grocery store, it must have been reviewed the same way a prescription drug is reviewed. But in the United States, dietary supplements are not approved by the FDA for safety and effectiveness before they are sold to the public. That point is important. It does not mean every supplement is unsafe. It does not mean every product is poor quality. But it does mean the system is different. With supplements, companies are responsible for making sure their products meet safety and labeling requirements, while problems may be addressed after products are already on the market. So the question should not be, does this label sound healthy? The better question is this product appropriate for me, for my age, my medications, my kidney function, my liver health, my blood pressure, my heart history, my diabetes risk, my lab results, my surgery plans, my actual diet? That is a much more useful question. And it is especially important because many people do not take just one supplement. They build a routine one bottle at a time, a multivitamin in the morning, vitamin D after breakfast, calcium with dinner, magnesium at night, fish oil, a joint product, a sleep aid. Maybe an immune support product during the winter, maybe an eye vitamin, maybe a powder added to a smoothie. Each one may have been added for a reason that made sense at the time. But your body does not process them as separate decisions. Your body experiences the total routine, the total dose, the overlapping ingredients, the timing, the interaction with medications, the effect on your stomach, blood, kidneys, liver, blood pressure, blood sugar, sleep, and balance. That is why more is not always better after 60. One of the most common misunderstandings is the idea that supplements are automatically safer than medications because they are natural. But natural products can still have strong effects in the body. Vitamin K is natural, but it can affect how warfarin works. St. John's wort is an herbal product, but it can change how the body processes many medications. Fish oil is widely used, but high doses may raise bleeding concerns for some people, especially when combined with blood thinners. The word natural does not tell you whether something is safe for your situation. It only tells you how the product is being described. Another misunderstanding is that a supplement can quietly replace a medication. This is where the message has to be very clear. Do not stop, skip, or change a prescription medication because of a supplement label, an online video, a friend's story, or a health claim that sounds convincing. If you take medication for blood pressure, diabetes, heart disease, blood thinning, thyroid disease, cholesterol, mood, seizures, pain, kidney disease, or any other condition, changes should be made with a qualified healthcare professional. A supplement may sometimes be part of a health plan, but it should not replace the plan without medical guidance. After 60 interactions matter more because many people are taking several medications. The body also changes with age. The way you absorb, process, and clear medicines can change. Kidney function may not be what it was at 40. Liver function, hydration, body composition, and sensitivity to side effects may change too. So even a supplement you tolerated years ago may deserve a fresh review now. And a supplement that is perfectly reasonable for your neighbor may not be right for you. Let's start with the biggest issue: interactions. A supplement can sometimes change how a medicine works. It may make a medication stronger, weaker, or less predictable. It may increase side effects. It may affect bleeding risk. It may interfere with lab tests. It may matter before surgery or a medical procedure. One well-known example is St. John's wort. Many people think of it as a natural mood supplement, but it can speed up the breakdown of many medicines in the body. That means some medicines may not work as well. This can matter with certain antidepressants, heart medications, transplant drugs, HIV medications, birth control pills, and other important prescriptions. That is not a small concern. Another example is vitamin K and warfarin, a blood thinner. Vitamin K can affect how warfarin helps prevent clotting. That does not mean a person taking warfarin should panic about every food or vitamin. It means consistency and medical guidance matter. If a supplement contains vitamin K, it should be discussed with the clinician managing that medication. Omega-3 supplements are another common example. Many people take fish oil because they have heard it may support heart health or inflammation. For some people, it may be part of a reasonable discussion. But high doses can raise bleeding concerns, especially for people taking anticoagulants or other medicines that affect bleeding. Calcium can matter too. It may affect absorption of certain thyroid medications and some antibiotics if taken too close together. Magnesium can also interfere with some medications. These are ordinary minerals, but timing and dose can still matter. This is why your pharmacist can be one of your most useful resources. A doctor may know your diagnoses and overall care plan. A pharmacist often sees medication interactions very clearly. If you take multiple prescriptions, asking a pharmacist to review your supplements is not being overly cautious. It is being smart. The next issue is duplication. This is one of the quietest supplement mistakes. You may think you are taking one vitamin D product, but vitamin D may also be in your multivitamin. It may be in a bone health formula. It may be in an immune support product. It may be in fortified foods. So without realizing it, you are getting vitamin D from several places. The same can happen with calcium, vitamin A, iron, zinc, magnesium, or B vitamins. A person may take a multivitamin, an eye vitamin, a hair and nail product, a sleep product, and an immune product, and never notice that several of them contain overlapping ingredients. The label may be accurate, but the total routine may still be too much for that person, and high doses are not automatically better. For some nutrients, too much can cause harm. Too much vitamin A can be harmful. Too much iron can be dangerous if you do not need it. Excessive vitamin D from supplements can lead to high calcium levels and serious complications. Too much magnesium from supplements can cause side effects and may be risky for some people, especially with certain health conditions. This does not mean normal. Appropriate use is always dangerous. It means guessing is not a good plan. The third issue is using supplements to chase vague symptoms without understanding the cause. This happens all the time. Person feels tired, so they add B12. Their joints ache, so they add a joint supplement. They sleep poorly, so they add melatonin or a sleep gummy. They worry about memory, so they add a brain product. Their hair is thinning, so they add biotin. They feel anxious about their heart, so they add fish oil. It is understandable. When something changes in your body, you want to do something, and a supplement feels like action. But symptoms can have many different causes. Fatigue can be related to poor sleep, anemia, thyroid issues, depression, medication, side effects, heart or lung problems, kidney disease, low protein intake, blood sugar changes, or many other factors. Joint pain can come from osteoarthritis, inflammation, injury, overuse, medication effects, or other conditions. Poor sleep can be linked to pain, sleep apnea, stress, nighttime urination, caffeine medications, or medical problems. Memory changes can be affected by sleep, hearing loss, depression, medications, vitamin deficiency, thyroid disease, or neurological conditions. So if you take a supplement for a symptom without understanding the reason, you may miss the real problem. That does not mean supplements never help. Someone has a real deficiency or a specific medical need, a supplement may be useful. But if the true cause is something else, the supplement may only delay the conversation that actually matters. Instead of asking, what supplement is good for energy? A better question is, why is my energy low, and should anything be checked? That small change in thinking can protect you. Now, there are some supplements that come up often after 60 because nutrient needs and absorption can change with age. Vitamin B12 is one example. Many older adults have less stomach acid, which can make it harder to absorb B12 naturally found in food. For some people, fortified foods or supplements may be easier to absorb. But that does not mean every tired person should start high-dose B12 without knowing whether they need it. Vitamin D and calcium are also common because they are tied to bone health. Vitamin D helps the body absorb calcium, and both are part of the conversation around bone strength and osteoporosis risk. But the right amount depends on diet, lab results, kidney function, medications, bone health, and personal risk. That is the theme again and again. The supplement may be reasonable, but the decision should fit the person. Not the advertisement, not the neighbor, not the most dramatic claim online, not a one-size-fits-all list, the person. There are also situations where supplement review becomes even more important. If you take blood thinners, every new supplement deserves a careful review. If you have kidney disease, minerals and high-dose products should not be added casually. If you have liver disease, herbal products should be discussed before use. If you have diabetes, supplements that claim to affect blood sugar should be reviewed with your clinician, especially if you take glucose-lowering medication. If you have heart disease or take heart medications, herbal products and minerals should be checked for interactions. If you have surgery or a procedure coming up, your healthcare team needs to know every supplement you take. Some products may affect bleeding, anesthesia, blood pressure, or recovery. And if you take transplant medications, cancer treatments, seizure medications, HIV medications, thyroid medication, or psychiatric medications, interactions can be especially important. This is not meant to make you afraid of every bottle in your cabinet. It is meant to move you from guessing to reviewing. Now, let's talk about warning signs. A new symptom after starting a supplement does not prove the supplement caused it. Bodies are complicated. Symptoms can come from many places. But it is a reason to stop guessing and contact a healthcare professional. Pay attention if you start a new supplement and then notice unusual bruising, bleeding, black or bloody stools, a fast or irregular heartbeat, severe stomach upset, vomiting, confusion, weakness, dizziness, fainting, rash, swelling, trouble breathing, or anything that feels clearly unusual for you. If symptoms are severe or feel urgent, seek urgent or emergency care. Also, pay attention to more gradual changes, more fatigue, more dizziness, new constipation or diarrhea, new sleepiness, more falls, new confusion, appetite changes, muscle weakness, nausea, changes in blood pressure or blood sugar readings if you monitor them. Those signs do not automatically point to a supplement. But if they started after a new product, a higher dose, or a new combination, your doctor or pharmacist should know. One simple habit can make these conversations much easier. Keep the bottle. Do not just say, "I started a vitamin." Bring the actual bottle to your appointment, or take clear photos of the front label and the supplement facts panel. The dose matters. The serving size matters. The ingredients matter. The form matters. A gummy, capsule, powder, tablet, liquid, or tea can contain different amounts and extra ingredients. This is especially important because supplement names can be vague. Two products can both say joint support and contain completely different ingredients. Two products can both say sleep support and work in very different ways. Your healthcare team needs the details, not just the category. So what are safe, practical steps? Start by making a complete list. Write down every prescription medication, every over-the-counter medicine, every vitamin, mineral, herbal product, probiotic, sleep aid, joint product, powder, gummy, tea, drop, or natural product you use. Include the dose, how often you take it, why you take it, and when you started. This list should not live only in your memory. Bring it to your doctor. Bring it to your pharmacist. Bring it before surgery or procedures. Bring it when a new medication is prescribed. The next step is to ask why. Before adding a supplement, pause and ask, what problem am I trying to solve? Is it fatigue, sleep, joint pain, bone health, memory, leg cramps, blood sugar, constipation, hair thinning? Then ask, has anyone confirmed that I need this? For some nutrients, a blood test, diet review, diagnosis, or medication history may guide the decision. For others, the evidence may be uncertain. Either way, asking why can prevent random stacking. The next step is to check for duplication. Look at your multivitamin first. Then look at every specialty product: eye health, immune support, bone support, hair and nails, sleep, joint health, energy, heart health. If the same nutrient shows up in several places, ask whether the total amount is appropriate for you. Then look at the serving size. Some people think one gummy is a serving, but the label may say 2. Some products list the dose per 2 capsules, not 1. Some powders use scoops that are easy to overfill. Some daily packs contain multiple pills with overlapping ingredients. Tease. Do not assume. Read the label carefully. Be cautious with high-dose products. A label that says extra strength or maximum strength may sound more effective, but stronger is not always better. After 60, high-dose supplements should have a clear reason and professional guidance, especially if you have chronic conditions or take regular medications. Also, be careful with claims that sound too good. If a product claims to reverse aging, cure arthritis, clean arteries, fix memory loss, melt fat, detox the liver, rebuild cartilage, restore vision, or replace medication, that is a warning sign. A medically responsible supplement conversation is usually more modest. It asks, do you need it? Is the dose appropriate? Does it interact with anything? Is it safe with your conditions? Is there a better way to address the problem? That is the kind of conversation that protects people. It is also important to understand what quality seals can and cannot tell you. Independent testing can sometimes help show that a product contains what the label says and does not contain harmful levels of certain contaminants. That can be useful, but a quality seal does not prove the supplement works for your problem. It does not prove it is safe with your medication, does not prove you personally need it. Quality is one question. Effectiveness and personal safety are different questions. And whenever possible, keep the food first idea in mind. Supplements are meant to supplement the diet, not replace the value of real food. Food brings nutrients in combinations pills cannot fully copy. Protein, fiber, fluid, vitamins, minerals, and other compounds working together. Of course, some people do need supplements because of deficiency, absorption problems, restricted diets, bone health, medical conditions, or a clinician's recommendation. But for many people, the foundation is still a nourishing eating pattern that fits their health situation. Now, when should you talk to a doctor or pharmacist? Talk to a qualified healthcare professional before adding a supplement if you take prescription medications, especially blood thinners. Diabetes medicine, heart medication, blood pressure medication, thyroid medication, seizure medication, antidepressants, transplant drugs, or cancer-related treatments. Talk to them if you have kidney disease, liver disease, diabetes, heart disease, high blood pressure, osteoporosis, a history of kidney stones, cancer treatment, upcoming surgery, or frequent falls. Talk to them if you already take more than one supplement. Talk to them if you are using a supplement for a symptom that is new, persistent, worsening, or unexplained. And talk to them if you are not sure why you are taking something anymore. That last one is more common than people admit. A supplement gets added during one season of life, and years later it is still in the pill organizer. Nobody remembers who suggested it. Nobody remembers what problem it was meant to solve. Nobody checks whether it still fits the person's health. After 60, a supplement routine should not run on autopilot forever. It should be reviewed, not obsessively, not with fear, but regularly enough that your healthcare team knows what you are taking and why. At your next appointment, you can ask a simple question. Can we review my supplements and see if anything duplicates, interacts, or is no longer needed? You can also ask, are there any supplements I should avoid because of my medications or health conditions? And if your list has grown over time, ask, which of these are actually necessary for me? Those questions are not anti-supplement. They are not suspicious or difficult. They are responsible. They show that you are trying to make careful decisions, not just collect bottles. Because the truth is, supplements are not automatically good or bad. The danger is guessing. Guessing that natural means safe. Guessing that more means better. Guessing that a supplement cannot interact with medication. Guessing that a quality seal means it will work. Guessing that your friend's routine is right for you. Guessing that a symptom is a vitamin problem when it may need medical attention. After 60, your health picture is more personal than that. Your supplement decisions should consider your diet, lab results, medical history, kidney function, liver function, bone health, medication list, symptoms, and goals. That is why the safest routine is usually simple, reviewed, and intentional. Not a cabinet full of products added one by one without a plan. So here is the main lesson. Supplements can be useful for some people. They can help fill real gaps. They can support specific health plans when used appropriately. But they can also duplicate nutrients, interact with medications, cause side effects, or delay proper evaluation when used without guidance. So, before adding another supplement after 60, pause. Ask what problem you are trying to solve. Ask whether you truly need it. Ask whether it overlaps with something you already take. Ask whether it could interact with your medications. Ask whether your doctor or pharmacist knows about it. Because taking supplements wisely after 60 is not about taking the most. It is about taking what makes sense for you. And the safest supplement routine is not the one with the most bottles. It is the one that is clear, reviewed, and known by the people helping you manage your health. If this helped you think more clearly about supplements after 60, subscribe for more.com. Practical explanations about health after 60. Medications, nutrition, blood sugar, circulation, sleep, and the body's signals worth paying attention to.